The cost of IT in business can be staggering. From hardware and software expenses to services like internet and phone, you don't need to spend a fortune on IT to succeed. If your organization spends more than $500 monthly on any service, or you're considering signing a long-term contract, IT Enabled can help you manage your technology and minimize your costs. Contact us today to schedule a free consultation. IT Enabled, we're here to help.
Welcome back to the Chamber Connect podcast. We're super excited to have you with us this week. We are so excited to be sitting down with Healthcare Professional of the Year, Dr. Jose Capellan. So excited you could join us this morning. Thank you so much for coming in.
Thank you for having me.
Of course, and congratulations on the award. If you'll tell us just a little bit about you, a little bit about your background and what you do, who you are.
Yes, my name is Jose Capellan. I'm a pulmonary and critical care physician. I've been in town since 1996, 28 years already. We came all the way from Chicago when I was in training for 4 years in pulmonary and critical care. Before that, I was in Puerto Rico, where my wife from too, and I trained internal medicine over there too. Then we got 3 kids, already grown up. My daughter, Lorena, Ivan, and Jose, they live in Houston, and they're no physicians. My wife's a rheumatologist too. She's a physician too. We are practiced together since 96 here in Lufkin. She's a rheumatology and a pulmonary and critical care. She basically do more outpatient, I do more inpatient too.
Mm-hmm.
Basically, we came to Lufkin been for 5 years, been here 26.
That's awesome.
If we like it.
That's awesome. So it's something interesting that I see. I see couples that are married that are both physicians more than probably any other occupation. Like I don't think I've ever seen 2 accountants that were married to each other. But why is that?
I think probably has to do with the medical school too. You know,
Mm-hmm.
medical career is a very long career.
Mm-hmm.
After you finish your high school, you go to pre-med. You met some people in the pre-med school, but then when you go to the medical school, it's a very tight training too. Then you meet in med school, then you get together. In my case, I met in med school back in the Dominican Republic, to where I'm from.
Mm-hmm.
Then we met there the first year, and we went through med school together all the 4 years. Then after that, we married at the end of after graduation too, and we went to Puerto Rico and then get together there, do the training together too, internal medicine training, both of us. The thing pushes you to stick together because you need a lot of support from the partner too.
Sure.
It's not easy to run a career like a medicine.
Mm-hmm.
Also, the affinity between your couple need to know exactly what you get involved to.
Right.
They know what you're dealing with, the time that you have to spend out of the house, the healthcare issue around your patient, the calls, the night calls, the assignment too.
Yeah.
I think it's very common to see a couple of physicians.
That's interesting. I've always wanted to ask about that. So I guess you both understand very uniquely what the other person is doing.
Well, it's a growing up all together. At the beginning is not like this. It's not a perfect word, but you start growing together, and then you have to make decisions together too. For example, in our case is we both did internal medicine the first 3 years, and then she got a motivation to be a rheumatologist because her mother had rheumatoid arthritis too. In my case, I had an uncle who had pulmonary problem, had a pulmonary fibrosis, very advanced, and then we decided after several years in internal medicine practice in Puerto Rico, come to Chicago and do the training in pulmonary and critical care and rheumatology. But it's not unusual to see couples. You see all the training together for so long. 4 years medical school, 3 years postgraduate med school, and then 3 more years in fellowship.
Yeah.
Then you either stick together very quickly or you break up.
So what brought y'all to East Texas?
Well, interesting too. When I was in Chicago, we got 3 kids already. They are already grown, 10 years old, 6 years old, and 9 years old. And we want to go back to Puerto Rico, but they get a warmer climate. Chicago was too cold for us.
Yes, too cold for me too.
I agree. Yes.
And I said, let's go ahead and do find somebody in the South here. We applied to Texas and Florida. That were the 2 states that we like to be on. Then the recruiter asked her to come to Lufkin, Texas for me.
Right.
I said, well, I came to interview, and then I kind of like the situation. It's a small town. We got 3 kids, kind of more control of the education, more control of the environment too. But I said, well, I like to come here, but at the same time, my wife is a physician too. She's a rheumatologist. I don't think I should be able to come here if she doesn't come to. And the hospital administrator said, well, you know what? We don't have any rheumatology in town. We don't know anyone. And they talked to the orthopedic doctor too. Oh, yeah, we need a rheumatology in town too.
Oh, nice.
And they offered both of us, well, you know what? Maybe you should go to Lufkin because it's kind of hard to see a area that both of us had a job to.
Right.
Then we got both together and then signed the contract and come here too.
Oh, perfect timing. Well, we're glad you're here.
Yeah, the same thing happened. We went to training in Chicago. We went in Puerto Rico for several years in Puerto Rico, and then almost 6 years in internal medicine practice already. And then you know what? They applied for the fellowship in rheumatology and pulmonary. Happened that we are taking the same place. You know what? If we don't do it now, we never do it because sometimes you can get training in Chicago, you can go to Texan training and different places too. Then this is the right place to go. Let's go ahead and go to Chicago too. Of course, too cold too for us.
I love that. Well, let's talk a little bit about your award. So tell us about your experience at the ceremony and how that went.
Yeah. I'm the kind of person that I know you do things in life, not expecting any award, not expecting anything, you do your job, try to take care of business. Like healthcare is a difficult business too, You deal with patients that put all the faith on you as a physician too. Then after being here for so many years, I didn't know that actually that's gonna come to me, to be so awarded. So the honor to be awarded by the Chamber of Commerce too. And came to me the memory when I came to Lufkin. I didn't have no idea how to run a business. I only know about taking care of patients. And then one of my supporting team asked me to come to the Chamber of Commerce. And I used to come to the Chamber of Commerce every Friday for the first year. And I learned so much about how to run the business, and then the CPA, the accounting, the lawyers, they didn't know how to run business too, and the insurance people too. I go on Friday once a month. They used to meet here and I get all together with them, and the second year I was already on my own too, and then I quit coming too, but then I never expected that Chamber of Commerce to honor me with this award. When they called me about you being selected as a candidate for the award, I said, to me, man, it's a candidate. You may just go ahead and see. Then I went there with my wife. Everybody knew about me.
That's how it's supposed to be, right?
Yeah. And then when I went to the theater downtown, suddenly I saw my staff there. I said, what are you guys doing here? My staff was there, and then the next thing I know, my son's coming out from Houston. I was walking, what are you doing here? Oh, okay. And then I realized how it was.
Oh, that's great.
But to me, it was a very honor to be awarded by the Chamber of Commerce. I think the Chamber have a lot of things to do with this town, business. And to learn a lot from the Chamber too. And then I see so many people around me telling me what I think I do normally, to me, no extraordinary. See, it was a very high point in my career when I saw that award too. And then I really appreciate that to the Chamber, really.
Awesome. Well, that's, again, congratulations on that. And that's so deserving. I want to go back to what you said about the business part of it. I thought that was really interesting. So you come out of as a small business owner, and I think it's really interesting that you have something that you're good at. So whether it be medicine or whatever it is, if you do plumbing or air conditioning, and the whole separate animal of this is the business side. So what did you learn in running your business? A lot of our listeners are other small business owners and things like that. So
actually,
what have you learned in that process?
When you come out of the medical school too, you go to training, you only know how to take care of the patient, how to put together diagnosis and therapy and diagnostic plan, treatment plan. When you go to training, the same thing. When you come out of the training, you feel like, what am I going to do? I get a job with a salary, or I decided to go to private practice. That model of practice was the one here. Your private practice model, or you can also practice in the hospital base. You don't have to worry about the business part.
You'll be a W-2 employee.
Yeah,
You don't have to worry about it. Yeah.
So, well, we decided to stick together. Then, well, okay, you got a overhead. What overhead mean? I have no idea. Well, of course, you have to pay your employees, all the legal obligation too. I didn't know much about that. I didn't know nothing about it. And then, thank goodness, all the people around here in Lufkin helped me a lot, especially the accountant.
Yes.
The accountant, and they say, oh, you need to organize this way. You know how to pay, how you got to payroll, how to do you do it with employees. You are, there's infrastructure that you have to grant to, IT, and I say, oh, this is a big deal here. But then I start getting people who know I'm getting hired for that, and they help me out to run the business too. And I think the instrumental part was my accountant. He really pushed me through the whole thing.
Absolutely.
But you come out of training, you have no idea what.
There's no accounting classes in medical school, huh?
You go there and see a patient, and you got a headache, or you got a chest pain, or shortness of breath, and you deal with a different diagnosis too, and see what the possible decision you have to. But the other part of bill insurance, bill you, co-pay, no co-pay. I had no idea what it was.
Wow, awesome. I love to hear those stories of people kind of getting started and doing business. That's awesome. Yeah, that's really good. So what were some of the challenges that you faced besides the business part of it, but just as a profession?
I was, let me put together, because in 28 years here and 40 years of medical career, it's a lot of challenge. But to me, the number one challenge was to move from Puerto Rico to Chicago with 3 kids to join a training. Not really
I can only imagine. Yeah.
Not to practice, just to training with 3 kids. Different town, different culture, different climate, of course. Then that was a challenge. But the second major challenge for me was in the last few years. To me, the pandemic really hit me hard. My specialty was hit very hard because you had to do ICU, intensive care, patient with a lot of the COVID, patient with pneumonia, a lot of people are very sick. Then really, you get used to, in my profession, pulmonary critical care, when you see somebody sick in ICU, sometimes a chance that you can lose a patient. But nobody wants to lose a patient. You had a family around them too. But it was a big challenge for me because I never see so many people dying on me. Right. On that particular circumstance. So he said, well, and then I feel like impotent. I had no control, and then I do whatever I can do, but at the end, still a patient die on me. Right. Young, old, precondition, no conditioning. Then that was very hard because we did it for the first year. Was very hard for us. We had to be working day and night. You got kind of burnout.
Oh, I can imagine.
That was to me was the 2 major challenges in my career was these 2. Moving from Puerto Rico to Chicago, and then the pandemic.
I can only imagine. So it's I think normal in medicine that sometimes you are going to lose patients, but to lose that many in that short of a time.
Well, so not only that in the critical care business, people coming with a high probability not to survive, but you can what you can do. But in this case, they come in, there's nothing we could do. And put in a ventilator, manage them. And the strategy was not only the patient, but the family. Yeah. Because the family was really suffering a lot. At the beginning, we got people, they cannot even go in to see their loved one. They're outside the hospital. You feel like, what's going on? Yeah. You feel for them too. Yeah. And they have to take care of the patient, but more to the family. Get out there, talk to them, and try to explain something that what you know. And they were desperate, with something totally unexpected for them too. That was very challenging for me, for the hospital, for the nation too.
I can't imagine.
Yeah. But thank goodness it's over.
Yeah, absolutely.
We learned a lot from that.
Thank goodness. Thank goodness. Well, we're so excited to have you here. Again, congratulations on Healthcare Professional of the Year. So deserving. It was so great getting to talk to you. Where can people find you? So if people are looking for your practice, where can they find you?
We are here in the medical center, number 3 Medical Center Boulevard here in Lufkin. It's close to the post office, across the post office in the Loop. I got our own building here. This is my practice medicine with my wife too in the same building.
Oh, that's great.
And Number 3 Medical Center Boulevard. It's close to the Woodland High area.
Awesome. Well, definitely go check that out if you are in need and if you're looking. And we want to thank you so much again for your time and joining us here this morning on the podcast. We want to thank you so much again for listening to the podcast. If you'll do us a huge favor, if you will go rate and review the podcast wherever you're listening, it just helps other people in our area find the podcast if they're interested in the type of interviews and stories that we tell every week. Thank you so much, and we'll see you next week.